The private insurance industry in America is unique and complicated. Today I'm going to explain it to you and help you understand it better. This is important because all Americans need healthcare, and also the private insurance industry is a topic of great political debate. I've done a lot of research to help me understand the industry, and I will hope to share that information that I've gained through my research with you today. First, I'm going to give you a rundown of the history of the industry, then I'm going to explain some terminology and how the industry works, and finally, I'll give you some figures and statistics about both the costs and the prevalence of the industry today. The industry started in 1929 when Blue Cross of Texas was formed by a group of Texas hospitals. They offered a subscription model for patients to pay for their services, which allowed the patients to pay less because healthy patients would defray the cost of sick patients. This model of insurance became prevalent in World War II when the government set restrictions on the payment that could be given to American workers. So to get around this, American industry and companies started to offer private insurance as a benefit to go above and beyond the amount that they could pay their workers. This practice became increasingly common during the second half of the 20th century, and the private insurance industry grew in pace with the medical industry as a whole, as people became more willing and able to get service as they had private insurance and more tests and services were also available. So the private insurers, in addition to mitigating the risk and spreading it across their clients, mainly act as a financial intermediary between hospitals and care providers and patients. On the hospital and care provider side, the insurance companies negotiate rates for different services with each hospital and provider. Generally, the private insurers pay a much higher rate than publicly insured individuals, and this helps to pay for a lot of the costs of of publicly insured individuals as well. On the patient side, a patient is required to pay a monthly premium, which is a set amount that they pay to have their insurance plan. When they go to see a doctor, a patient will sometimes pay a copay, which is the amount of money that they pay for the service at the time of service, in addition to their premium. Not all plans have copays, but many do. The other kind of plan that you can have is a plan with a deductible. A deductible is an amount of money that the patient must spend out of pocket before the insurance company begins to reimburse for any sort of medical services. In America today, the private insurance industry is enormous. Around 90% of the adult population and 95% of the juvenile population are insured according to the CDC. About 69% of adults under the age of 65 have private insurance, and about 54% of children have insurance as well. Both of those numbers come from the CDC. According to eHealth Insurance, the average premium for an individual was around $440 a month, or $5,280 a year. It was about $1,100 a month for a family, which worked out to about $14,000 a year. And the overall total cost of care for patients in America was $3.6 trillion in 2018, according to the Peter J. Peterson Foundation, or about $11,000 per person. So, today I've explained to you the history and also the form and function and current makeup of the insurance industry. Remember that it's important to understand this because we all have to have insurance at some point, and the insurance industry is a topic of hot debate. I hope that from now on you'll have a better understanding of how the industry works, how big it is, and how we got to where we are with it. It's truly a unique and very complicated system which came about largely by accident, and which we have to figure out how to improve today if we want for everybody to have fair access to care.